when I got my last steroid shot, I actually cried on the table. And the doctor thought I was crying because I was in pain. I was actually crying because I was so frustrated. I am the CEO of a design firm called KBD, based in Louisville, Kentucky. And all of our clients are here in the Bay Area, but we work from the Midwest, doing websites and logos and that sort of thing for technology companies. So I had always been, well, not always, but I had been a runner for about 5 years and was training for a mini marathon and decided to do a little bit of hill work, and heard a little pop in my hip, and it started going downhill from there. And I just thought it was something that would just go away on its own if I just gave it a rest for a little while. So I didn't do the mini, and I kept just sitting on the couch resting, and it didn't go away. So eventually, about 2 or 3 months after that happened, I finally made a doctor's appointment and went to go get an MRI done, and they suspected a torn labrum. And sent me to a doctor that suggested surgery right away. And I've never been in the hospital except to have my 2 kids, and I'm really busy, and I don't have time for a lot of downtime that would be a result of a surgery like that. And so I asked for other options, and they said, oh, well, you should just rest it for a while and be really careful about, running or exercising, and, even walking, you really should be careful about that. And this was not resonating with me at all. So I went and saw another doctor, got a second opinion, who also suggested that I have surgery done right away because I apparently had one in front and in back, and thought that that was going to be the answer to my prayers. And I said no, I just didn't want it. So he gave me a steroid shot, which did not help, by the way, and sent me to PT. And the PT that I ended up going to was primarily for, seemed like women in their mid-60s, early 70s who were riding stationary bicycles and were there for cardio rehab and a bunch of other things that I just felt completely out of place. And so I kind of did the PT but then the hip issue started getting worse, and I was just sitting on the couch all the time. So I would call the doctor, and he'd give me another steroid shot. And this cycle went on for 2 years. So I had stopped running. I came home every night really sore. I couldn't walk, I couldn't walk around the block without it getting really sore and achy. So I'd come home from work, I'd have a glass or 2 or 3 of wine, self-medicating, and I sat on the couch all night long, and my kids started complaining that I was getting boring and I wasn't playing with them anymore. After I decided I didn't want surgery, I decided to do a little bit more research online about what my problems were and if I had any other options. I also felt that since I wasn't finding the right medical care in my area, that since I was out in the Bay Area frequently, I would do a search for hip health, hip doctors in the Bay Area, and that's where I found Upright Health. And I started watching Upright Health videos, and it really resonated with me. I've always been pretty athletic and focused on fitness and strength training. I was a gymnast as a kid. All of those things kind of made me believe that strength training might actually help me. And the way that the videos were put together, even just doing some of the exercises that I found on YouTube, were really, really helpful. And then reading the blogs and the essays, I became a believer. And so I made an appointment for Upright Health's parachute program. And on my next business trip out here, I came and met with Trevor. He was very patient with me. When I first got to Upright Health, I had very little mobility. I was a little bit self-conscious of how limited I was considering my age and just my personality. My mobility did not fit me at all. And I was embarrassed, actually, when I first met him. But he was really patient and gave me some very easy, looking back, some very easy exercises to get started that were more of a diagnostic. And really figured out exactly, right away, faster than any of the doctors did, exactly where my problem was and what muscles around it needed to be worked on, and gave me some pretty simple exercises to do at home. Which I started doing religiously every single day. And then since then, I've been meeting with Trevor via online Skype meetings once a month. just to kind of review where I am and giving me new exercises, and he can check in and see how I'm doing. I actually am in the Bay Area frequently, so when I'm here, I actually come in person and get some in-person consultation. And so fast forward 6 months now, my hip problem is pretty much gone. I also had some knee problems that were not related, but Trevor found them and helped me, and we're currently working on those as well. I'm running again. I'm running a 5K next weekend, and my kids are happy. I should also mention that I had gained about 25 pounds during the time that my hip was messed up. I've since lost that and more since working out here, and it's been a really great experience for me. First of all, do your research. Not every doctor knows everything. And it's up to you. It's your body. You know what's right for you. And trust your gut instinct on it. And do a little bit of research. Figure out exactly what it is you have, why you have it. And once you understand kind of the mechanics of a labral tear in your hip, you'll start to understand that there are ways that you can fix it that are not surgically required. Yeah, do your research. Being in pain is frustrating. And it's hard, especially when you feel it's happening before your time. And if you have children, or if you have a busy job, or if you have employees that look to you and you're supposed to be the strong one, to feel vulnerable and to feel like it's not going to ever get better is really, really hard. For me, at least, it drove me to find better solutions. And that's why I did the research and found Upright Health and believed in Upright Health and gave it a shot, because I truly believe that you can get better. A lot of it is mind over matter. A lot of it is really pushing yourself to get to the next place, and I feel like I've done that here. When I first started, or before I found Upright Health, I was feeling really hopeless about what my future was going to be. I thought that I was going to be hobbling around, an old lady before my time. I didn't want to do surgery. PT wasn't working for me, and I was feeling really distraught and sad and emotionally just drained. When I got my last steroid shot, I actually cried on the table, and the doctor thought I was crying because I was in pain. I was actually crying because I was so frustrated. So frustrating. And so when I found Upright Health, I moved from being hopeless to just a little glimmer of hope. I was just hopeful. And I really believed that if I worked hard on strengthening my hip and strengthening myself, that I could be better. And 6 months later, that being hopeful has changed to being confident. And I know that I can do this. I actually have done it. My hip is way better. I'm running a 5K and maybe signing up for a half marathon next spring. And it's because I feel like I can do this. I know I can do this. The team at Upright Health is fantastic. The experience I've had working out here in person has been different than I've experienced in my entire 50 years. There's an emotional connection there that happens when somebody understands where you are and where you want to go. And that doesn't always happen when you go to the gym, or even when you go to a PT, or even if you go to a chiropractor. There's a personal connection with all of those people, but I think what makes Upright Health different is they really understand the frustration of pain, and getting you out of it is as much of an emotional journey as it is a physical one. Today, I am healthy and happy and hopeful and confident thanks to Upright Health. And remember, pain sucks, life shouldn't.